Yeah, my name is Hoyne. I'm a consultant psychiatrist and editor of Global Psychiatry Archives, and I'd like to present an interesting study from northern Nigeria, and it's about displaced people and the relevance of mental health literacy on the prevalence of depression and PTSD among internally displaced persons in northern Nigeria. So they're quite, on total, there's 700 people, and that's the 700 people who were selected from these internal displaced camps. Some had incomplete data, and 637 had complete data, and we were analyzed by this team. So there was quite a few scales, which I think you should read up later. So these are the sociodemographic data, quite young people in this sample. There are lots of males, a bit more males, lots of people unemployed or having small business or being students, and different levels of education. Some had none, some had secondary school, different marital status, different religions, and different family income. And there was monogamous and polygamous family. And this is the table 2 is the categorization of mental health literacy, which is according to the standard. And what you see is that only 26% had good mental health literacy. The mental health literacy is about the knowledge about how to deal, how to recognize, how to deal, and how to get help in depression or other mental health disorder. In this case here, depression. Right. So what you can see here is that in different age group, the mental health literacy is slightly different, and astonishingly in the people around there 15 to 19, it seems to be highest. So that's a bit unusual, but it's the case, and explaining that is another story. So what you can see in the demographic, in the analysis, statistical analysis, so it seems that the age of the person plays a role. Maybe it's still people who are in training and who have recently been focused on mental health, which is quite common that, you know, during this time, COVID and post-COVID, that people are, when they're in education, that there's more focus on mental health literacy. However, the employment status and the student status didn't play a major role. Polygamous families did have less, or people from polygamous families had less knowledge on mental health. And interestingly, now so what we find is that mental health literacy is not very common, but better and slightly better in those with in the late teens. And, you know, in these samples of internally displaced people, there's lots of depression. Scares is another story. Please look at the paper. And it's free, available on Global Psychiatry Archives, the journal website. And what you can see here is that, you know, there are lots of depression. And the question is, does it have to anything to, or PTSD as well, high rates of PTSD. And what you can see is that the presence of depression is related to the mental health literacy. So let's say good mental health literacy leads to lower depression rates, and the same applies for PTSD symptoms. So the better mental health literacy, the less likely you have symptoms. And these are the other predictors of depression. And, you know, it's this age range, you know, so, but more or less there's nothing really significant. So the major symptoms here, predictors of PTSD. So there's nothing really significant except that, you know, so have polygamous members from polygamous family who are traumatized a bit more with PTSD. Lower or higher income seems to be better as well. But the big thing is what you can really do is, and this is what you can learn from this study, the better the mental health literacy, which is something you can train and teach people about, and where's lots of training still needed, that increases the chances to avoid depression. So in this respect, there's something which we can do for people who are internally displaced, teach them about mental health literacy, and their depression rates may go down by them applying what they've learned. Thanks a lot for your interest, and if you want to listen to more of these papers, please subscribe to our website. Thanks a lot.